So if you've got pain in your shoulder and moving it causes pain, you're not going to move that shoulder. Okay. You might find that, you can do some movement without pain. Stick to that. That's perfect. But the things that actually do hurt to do, especially in that first kind of 3 month period, so where you're testing out to see, does this get better? You don't have to push into the pain. You don't have to test, does this still hurt? You're just going to start moving the rest of your body. So anything you can move without pain, you want to be moving. Why? This is going to improve your blood flow. Okay, so it doesn't have to be intense exercise. It doesn't have to be stuff that's difficult and stressful and uncomfortable. It's just, if you can walk, go for a walk. If you can move the other arm, it doesn't even have to be like a specific gym looking thing. Just move it around as much as you can. Any part of the body. You can move your head, then move your head. You can move your mouth, you can move your toes. All the things you can move. The blood flow increases a little bit. As the blood flow increases, you get more chance to improve any kind of tissue damage. So, there's going to be certain nutrients, there's going to be all different fluids that need to be delivered to that area. If your blood flow is slightly increased, you get all of it delivered a little bit more quickly. So, whether it's something that's broken or whether it is something that is just, mildly grazed or sprained or something like that, the advice is still the same, is, if it hurts to move it, you probably shouldn't move it, especially in the first week or so, where you're seeing, does resting this area cause things to improve? But the other stuff can still move. Don't put yourself in a dangerous situation, where you might fall and then re-injure. But movement other places can be really good. Specifically, when it comes to the limbs especially, but can be in the trunk as well, movement on the opposing joint can be really helpful. So for the right arm, we're going to look to the left leg, and for the left arm, we're going to look to the right leg, and vice versa. So if it was the right leg that's in pain, then we would move to the left arm, and the left leg we'd move to the right arm. And just treat those joints as like mirrors. So if you find you've got pain in the right shoulder, you're probably going to get maximum benefit from doing a lot of movement in the left hip, assuming the left hip is not also painful. Same goes, if you've got right knee pain, then we'll go to the left elbow. Left wrist pain, we'll go to the right ankle. Just treat these joints as like mirrors of each other. This, again, is going to improve blood flow, just like we wanted before. But there's also some reflexive actions that go on here. So when you walk, your brain has lots of reflexes that connect the right arm to the left leg and the left arm to the right leg. And so all the time when you're walking, that reflex gets stronger and stronger and stronger. So the same way I said that pain can be a habit, so when you just always lift your arm up and the brain says, okay, I'll just make it hurt. Your brain also gets used to the fact that you walk more than you do pretty much anything else. So every time you have that right arm swinging forwards, your left leg says, I'm probably going to swing forwards right now. Even if you're sitting down and you move your right arm forwards, your left leg gets ready as if it's going to do that forward swing, just because there's a good chance that that might actually happen. So the muscles get primed, the nerves get primed. When you start training the left hip, you can sometimes improve your right shoulder pain just by the fact that you're firing that reflex. So you're getting the muscles working because they're getting primed and relaxed without actually having to physically move that part of the body. Similar to this, if you've got some kind of injury to your right arm doesn't move so much, moving the left arm can also help quite a bit. The two nerves, so the nerves on your right arm connect to your spine and they're right next to the nerves on the left arm. If you start moving the nerves on the left side, they start tugging on the spinal cord, and that causes little bits of tugging on the right side. And again, it can just prime that side of the body for movement.